Welcome back to our channel. Today we will be chatting about the top 5 differences between functional blood labs and conventional blood labs. Blood labs are used to gather data about a person's health to determine a disease or treatment plan. There are key differences between functional blood labs and conventional blood labs and how they are used to evaluate health and determine a course of action. With functional blood labs, it can provide practitioners a way to really dig deeper into what's happening in the whole body and why it's happening, allowing us to really catch early signs of disease years before conventional blood labs would ever pick it up. This is partly due to the way standard medical ranges are determined, making it super easy to fall into the normal range even when you feel awful. Practitioners trained in functional blood labs can provide very rich data about a variety of body systems, such as nutritional, gastrointestinal, hormonal, immune, endocrine, metabolic, detoxification, and more. So all of this data not only helps practitioners, but clients truly understand what's happening in their body to stop disease in its tracks. Everyone deserves to have this type of access and answers that go beyond conventional medicine. My name is Jasmine. I'm a certified nutritional practitioner, founder and CEO of Organically Glow, an online nutrition practice rooted in functional medicine principles, helping women get real answers to their health struggles beyond the mainstream with functional lab testing, nutrition, and lifestyle medicine. So let's dive into the top 5 differences between functional blood labs and conventional blood labs. Number 1, the approach to health. So the approach to health when it comes to functional blood labs is completely different from conventional blood labs. And you're going to hear me say that throughout the whole video because it's true. So functional blood labs, they focus on optimal health and prevention. And we do this by analyzing a very broad range of biomarkers to assess overall wellness and detect imbalances before they become diseases. So we emphasize a personalized medicine approach and individualized treatment plans when we're using functional blood labs. So specifically when it comes to functional blood labs, when we're looking at our root cause lab test, we are looking at 65 biomarkers. And honestly, it's more than that. We probably have about 70 to 80 different biomarkers that we run, and we're actually able to see so much in the body. Like I said, we're looking at your digestion, we're looking at drainage, we're looking at inflammation levels, we're looking at potential root causes such as the bacterial, viral, parasitic infections, and we're also looking just to detect imbalances in your nutritional needs. So with conventional blood labs, they primarily focus on diagnosing diseases and medical conditions. They just typically analyze specific biomarkers related to diagnosing illnesses, and that's because insurance companies really don't allow them to run comprehensive blood labs or looking at over like 65 biomarkers like we do, because there has to be an indication for them to do that so your insurance actually covers it. Number 3, the conventional blood labs, they are aimed to determine if values fall within standard reference range for diagnosing medical conditions. So this is why when you go to your doctor and you honestly feel horrible, you have a long list of symptoms, maybe you're dealing with gut issues, low energy, brain fog, anxiety, depression, you do blood lab testing or you do any type of testing, and what do they say usually? They come back and they say all your blood labs look normal. There's nothing that looks like you need to actually be treated for a medical condition because you don't have a medical condition yet. You just have imbalances that if they are not taken care of right now, they can eventually lead to disease. So functional blood labs, again, they really focus on looking at optimal health and prevention. And then conventional blood labs are really focused on diagnosing diseases and medical conditions. Number 2, the biomarker range and interpretation of the biomarkers. So with functional blood labs, we use a very narrow reference range based off of optimal health rather than just the absence of disease. So we consider subclinical deficiencies and early signs of imbalances. So for example, with vitamin D levels, when we're looking at it from a functional blood lab perspective, we want your levels to be at least 70, right? With conventional blood labs, when they are looking at vitamin D levels, they say you're okay when your levels are at 20. That is a huge difference. When you are under 50 to 70, that level is going to be so low that you're going to have symptoms. So, this is why we like to keep the ranges super narrow so we can actually see imbalances in the body and understand where your symptoms are coming from. So again, with functional blood labs, we really focus on incorporating advanced testing. So these tests are not commonly used in conventional medical system. They are not really accepted. So if you go to your doctor and you're like, I want to run all these biomarkers, most often they are not going to run them because it's not indicated to do that. And most of the biomarkers we're looking at, they completely just disregard them from the medical system because the doctors are not trained on those specific biomarkers. These biomarkers that we are looking at are specifically looking at specialty biomarkers. So, for example, insulin. Fasting insulin is one of the specialty markers that we run in our practice, and it's because it can provide us early signs of insulin resistance, prediabetes, diabetes, and so it's really important to understand your insulin levels so we actually know and where we actually can understand what is causing your low blood sugar or your symptoms related to fatigue, low energy. Maybe you're just super irritable when you're skipping meals. Your blood glucose levels may come back normal, but your insulin levels are probably super, super high. This is a marker that conventional medical system does not run, and we really want to run that marker because it's so important for early signs of disease in the body. Conventional blood labs, when we're looking at the biomarker range and interpretation, so they use a broader reference range based on population averages. So if you think about it, who goes to the doctors? Very sick individuals, right? If you are healthy, you most likely are not going to the doctors, you are not going to the hospital. That's just how it is, right? But if the people who are going to the doctors are extremely sick, they are not feeling well, there's something going on in their body, and they are the only ones who are getting blood lab testing done, that means those reference ranges are going to be extremely large because they are based on the average of the population. So again, that is why it's so easy to go to your doctors, you tell them all your symptoms, yet your blood labs look normal. Number two, with conventional blood labs, they primarily detect diseases. So that is all they're looking for. They're looking for a disease, they're looking for a diagnosis. If you don't have that, your labs are normal. Typically, when we're looking at conventional blood labs, they just stick to the standard, widely accepted tests. So that is where insurance comes in, right? If your insurance doesn't cover it, then they're most likely not going to run those tests. So that is the biggest difference between functional blood labs and conventional blood labs. Number one, we use very small reference ranges that are focused on optimal health rather than just the absence of disease. Number three, we are looking at the actual testing philosophy when it comes to functional blood labs. So with functional blood labs, we take a holistic approach. We are not just considering your blood markers that are out of range. We're looking at your lifestyle, we're looking at your diet, we're looking at environmental factors, and a lot of our tests that we run may include different assessments on your nutritional status, on your hormone imbalances, and on toxin exposure. We also aim to identify root causes of symptoms, and we also want to promote long-term health, right? That is completely different from our conventional blood lab system. So with conventional blood labs, they are very symptom focused, disease oriented. They primarily focus on tests that really just indicate specific diseases and conditions. They are very reactive when it comes to symptoms. So instead of just taking a proactive preventative approach, they are reactive. So as soon as your blood work comes back as abnormal, that's when they start addressing the symptoms that arise. So the biggest difference here is functional blood labs takes a very holistic approach. We're not just looking at your test markers or your biomarkers. We're actually looking at your lifestyle, your diet, environmental factors, your hormones, nutritional status, and of course, toxin exposure, compared to conventional blood labs where they're just primarily focused on symptoms and diseases. Number 4, customization and personalization. So with functional blood labs, results are often integrated into your personalized health plans. So recommendations may include your diet changes, supplements, lifestyle changes, and maybe even like natural wellness therapy. So maybe going in the infrared sauna, cold plunging, all of these things are going to be implemented into your health plan. And then often we do have follow-up testing to actually track your progress and adjust your plans as needed. So for example, I had a recent client, we just did some retesting on her blood work, and all of her inflammatory markers were completely in normal range after just 3 months of working together. So that's huge. So diet, supplements, lifestyle changes, and natural therapies that we implemented into her wellness plan actually helped to dramatically decrease her inflammation in her body. With conventional blood labs, results are typically used to just prescribe a medication or other medical treatments. So their most common medical treatment is surgery, medications, like they said, prescriptions, and those are like their two most commonly medical options that you have. They also follow standard medical guidelines and protocols, so they're not just basing it off of your specific body, they're basing it off of just the disease. So they're not focused on treating the person, they're focused on treating the disease that you have. They also have a less emphasis on personalized health optimization, so they're just primarily focused on disease management. So if you guys are interested in getting your blood work read from a functional perspective, if you have recent blood work that you have done in like the last 3 months, we do have a free offer right now. We are doing free blood work reviews. So make sure you click the link in my description and you book that, and we can talk through your functional blood lab results and see what potential root causes you have. And we can also talk about a personalized wellness plan for you. Lastly, number 5, so patient engagement. So when it comes to functional blood labs, we really want you involved. We want the client involved in your health and wellness because you're the one who is going to be actively implementing what we tell you to do or what we recommend. We also provide very detailed reports with comprehensive explanations and, of course, actionable insights. So that is your personalized wellness plan. We give you the results of your functional blood labs. Based off of those blood labs, we also give you a very personalized approach to what to do, what to implement in your diet, in your every day-to-day life. So is that stress management? Is that exercising more? And we provide you exactly more details on that. And of course, supplements. Often we educate, right? So we want to educate you. We want to really empower you. So we provide tons of educational resources, videos, and support to help you implement these different lifestyle changes because we want you to actually change your life, right? In order to become healthier, you have to make the changes in order to do so. With conventional blood labs, reports are typically just straightforward and designed for clinician interpretation. So most often you will not hear your doctor explaining to you why things are high, why things are low. They don't just take a very holistic approach looking at the blood work. They just say this marker is low, that's it, take this medication, right? They are very less direct, so they don't have engagement with you regarding your results. Like I said, most of my clients who come to me, they have been to their doctor, they have asked what their blood work looks like, what is actually going on in their body, and they're not told anything. So that is one of the biggest issues we see too, is just a lack of communication and education between the client or the patient and the doctor. They also just focus on a diagnosis and treatment rather than educating the patient on what's going on in their body and why they should take this medication or how they are going to feel in a couple months. There's no patient education. So this comparison just really highlights how functional blood labs and conventional blood labs differ in their approach to health and their interpretation of the results and their testing philosophy and the customization and patient engagement. So when it comes to functional blood labs and conventional blood labs, those are the top 5 differences between the two. And if you guys are interested in really learning about what is going on in your body, if you're ready to take control of your health and achieve optimal wellness or just work towards it, get your blood work read from a functional perspective, especially if you already have blood work done. Make sure you head over to our link, click that, get that free blood work review, and we can go over them in depth on what is going on in your body and truly understand what you can do to help your body start healing. Thank you again for watching this video. If you guys like this video, make sure you subscribe, and of course, we will see you at the next one.